Right, good morning everyone, and thank you very much Alison, and thank you very much Molly, Eunice and Daisy. Fantastic way to start the conference. My role first and foremost is to give some housekeeping, so I will do that. So what I want to do is just start by saying something about the news headlines of the last week. And we've had, last Thursday, we had a report published by the Care Quality Commission, State of Adult Care and Healthcare in this country. And on the same day, we had another news story about Marmite. And I challenge you to look back at last week's media coverage and just ponder which of these two stories was the biggest in terms of the number of column inches it generated, the number of items that were at the top of the news bulletins. And I think Marmite trumped Care, which is tragic when you consider the background of the services that many of you are involved in, the challenges that the care sector faces. Indeed, just last week, in terms of this report, it sparked a whole series of headlines about the state of health and social care, about our social care system being incredibly fragile, about the NHS deficits. And we had this said by David Behan, the Chief Executive of NHS England, Chief Executive of the CQC. In his report, he warned about the fragility of the social care system, and he warned that we were at a tipping point. Now, Alison, in her remarks, I think quite rightly said that the opportunity for this conference and the focus of this conference is very much about being part of the solution to the challenges of a very stretched and stressed health and social care system, whether that's financially or whether that's in terms of workforce. And that burning platform, if you like, is really this conference's opportunity. We have a packed program of presentations, of other sessions. We've had many product launches taking place here as well this week. And also, we've had the opportunity to network. So I hope you enjoy the conference. My role really now as conference chair is to introduce the next presentation. It's a presentation by the new Minister for Innovation and Public Health, Nicola Blackwood. We have a video presentation from her, and we're going to cue that up and start with that, and then I'll be introducing our speaker after that. So without further ado, can we run the video from Nicola Blackwood, please?
As Public Health and Innovation Minister, I want to ensure that we continue to highlight the huge opportunities for technology to support better health and care. The theme of this year's conference, Connected Care, Connected Homes, Connected Communities, is at the very heart of this government's agenda on personalised care. To support people to live independent lives in their homes, we need to ensure that technology is co-designed with the service user and tailored to meet their specific needs. Technology, designed and implemented thoughtfully, has the power to help address inequalities. And as you've seen in Molly's inspirational video, digital technology has changed her life and enabled her to play a more active part in wider society. The government is committed to investing in technology to tackle inequalities and to help the most vulnerable people to live more independent lives. We have made 25 million available over the next 2 years in technology and housing for people with learning disabilities, and there has also been a significant increase in the Disabled Facilities Grant over this current spending round. But we need to realise our ambitions for integrated health and care, and technology can play a key role to help us achieve this. And although some progress has been made, we need to address the interoperability barriers so that devices and sensors connect together in the home and in other settings. And we all have a role to play to build public trust and confidence in technologies, reassuring users, patients and carers that they are safe and secure. And the government has made a significant commitment to enhancing the role that information and technology can play in the delivery of health and care services. And we've invested in key programs of work derived from Personalised Health and Care 2020. And I do encourage everyone here today to engage and connect in this exciting delivery agenda led by NHS Digital. Government, industry, commissioners, citizens and carers all share a responsibility to do more to make people aware of what technologies exist to support and improve people's lives. And it is events such as yours that can help us to consolidate and share intelligence, to spark new ideas and connect us in pursuit of these ambitions that will help us to deliver an NHS that is better for all. Thank you.
Thank you very much, Nicola. And as you gathered, she wasn't able to be with us, but was very keen to provide that presentation to us and setting out the government's views. And I'm sure there are points in there we can reflect upon during the Q&A sessions later on. Now, I'm moving us on now to our next presentation. It's on the integration of health and social care in Scotland. And we have Professor George Crooks, OBE, who's the Medical Director of NHS 24, who's going to come and address us, and also will take some questions. So, George.